Okay, we'll go ahead and get started. Welcome everybody to our legislative briefing on surprise medical bills. My name is Jen Engstrom. I'm the state director for CalPIRG, the California Public Interest Research Group. And on behalf of our organization, our national partner US PIRG, and the state PIRGs around the country, I want to thank you all for joining this opportunity to learn more about the Federal No Surprises Act, as well as actions that states can take to ensure that the public is better protected from unfair and unavoidable out-of-network medical bills. So in this short briefing, we are going to talk about the problem of surprise medical bills and the new protections under the Federal No Surprises Act. We'll discuss actions that states can take as well to further protect their communities through improved oversight and enforcement, as well as extending surprise billing protections to ground ambulances. And to take us through all of this, we are joined by Patricia Kelmar. She is the Senior Director of Healthcare Campaigns with PIRG. Patricia is a leading advocate on health policy, and she sits on the Ground Ambulance and Patient Billing Advisory Committee. And then after her presentation, we will open it up to questions as well using our Q&A feature. We're recording this session, so we'll be able to send that out afterwards as well, though we won't record the Q&A. Okay, so I'm going to hand it over to Patricia, and then I will share your slides in a moment too.
Great, thanks, Jen. Yeah, thank you everyone for joining. I'm really excited to give you a little background, and then would love to have a nice, robust conversation in this opportunity to really kind of talk about what's a very important law on the books and make sure that folks really understand and know their what the law does, and then make sure that we talk about ways that it can even be improved. So looking forward to that. Let's get started. Sorry, I just lost the vision, of course, but here we go. So a lot of medical bills are surprising to consumers, but there is a particular type of bill that is the most unfair and causes significant financial distress for insured families. Surprise bills are those bills that patients receive from out-of-network doctors and hospitals. Patients get balance billed for the difference between what their insurer covers and what an out-of-network provider charges. These bills come often from out-of-network anesthesiologists, emergency room doctors, radiologists, and sometimes from labs or imaging services based in a hospital. Insurers pay part of the bill, but the patients have to pay the rest. Too often, patients are unaware that they even receive treatment from an out-of-network provider until they're home recovering and receive a bill for hundreds or even thousands of dollars. So these out-of-network bills, as I mentioned, are really expensive. Studies show that average ER bills are about $600, but childbirth out-of-network bills are $750 on average, and for anesthesia, patients were receiving bills for about $1,200. So more than 20 states recognized and realized that they needed to do something about it and have already passed surprise billing protections. But the problem was that those 24 states that did that, the law didn't cover all of the residents that had insurance in the state. And only about 40% were covered through these state protections. And that's because about 60% of insured families in the US are insured by their employer. They are insured through an employer-sponsored self-funded health plan. Sometimes they're known as ERISA plans. And ERISA plans are exempt from state laws. So that meant that people in insured plans through their employer, for the most part, were not covered by state protections. So we continued to fight for protections across the country by getting Congress involved. And finally, in December of 2019, Congress passed protections for all insured people in all 50 states. And that law is called the No Surprises Act. It took a while to write the regulations and get the protections in place, but the new protections went into effect on January 1st of last year. So surprise medical bills that were incurred after January 1st of 2022 enjoy the protections that exist under the No Surprises Act. And since the law was put into place, about 1 million bills a month are banned. That means hundreds of millions of dollars in savings for patients. So let me just give you a quick, brief overview of the law as it stands, and then we can talk about what additional protections are needed. So next slide, please. So here are the basics of the law. Under the No Surprises Act, out-of-network doctors and healthcare facilities are prohibited from sending a balance bill to patients in these situations, right? When they receive care in an emergency room, if they're at an in-network facility, the anesthesiologist, radiologist, anyone else touching them in that in-network facility cannot send an out-of-network balance bill. And for air ambulance transportation, that is the helicopter or the airplane that would take you in an emergency. In those situations, even if those caregivers are out of network, they are not allowed to send a balance bill. Unfortunately, we're just seeing a helicopter there. We're not seeing that ground ambulance, which is the emergency transportation that most people use in an emergency situation. That was not covered under the No Surprises Act, but we'll talk more about that in a little bit. So those are the types of protections that protect people, but there are limits as to where those protections apply. So location really matters. These protections are covering services in certain types of healthcare facilities, which you can see here. But of course, there are other healthcare facilities where patients might be treated by an out-of-network provider, and they aren't protected under the No Surprises Act for that, unless, of course, the state law covers that. But as far as I know, for the most part, places like physicians' offices, where you might be told by your doctor, oh, go to the door down the hall, that's a lab that can take your blood. Oftentimes, those might be out of network for the patient, even though the provider is in network. Also birthing centers, clinics, hospice, addiction treatment facilities, nursing homes, urgent care centers that aren't licensed to provide emergency care. Those are some of the exemptions. So people who go to those places and get an out-of-network provider giving them services could still be subject to a balance bill. Next, please. So there are additional protections for the situation of a patient who has been brought to an out-of-network facility, an out-of-network hospital, for example, in an emergency situation where the ambulance just takes you to the closest hospital. So now the patient is in an out-of-network hospital, they're getting emergency care. At some point, the emergency is over and the patient is considered stabilized. The No Surprises Act continues to give you protections from out-of-network bills even after you're stabilized in certain situations. So you'll still just pay what you pay as if you were at an in-network facility paying your normal in-network charges. But the hospital and the doctor could ask you to move to an in-network facility once you're stabilized if all of the following conditions are met, right? So I've listed them out here, and this makes a lot of sense, right? You can't move a patient who's just been stabilized to another in-network facility, unless they can travel safely without medical transport to that in-network facility. Making sure that there is an in-network facility available and willing to accept the transfer of that patient, that their patient wouldn't undergo unreasonable burden to get to that new facility. And the patient has to consent to that transfer. So all of those conditions have to be met before the patient would be subject to any out-of-network balance billing at an in-network facility that they came to because of an emergency situation. It's a little complex, but it is a protection for people, especially who enter a hospital in an emergency situation. Okay, next one. There's another little nuance in the No Surprises Act with a nod to the fact that there might be certain patients who want to use a out-of-network provider. So the law allows certain providers to ask patients to waive their surprise billing protections. Unfortunately, it's called the surprise billing protection form. It should really be called the I'm waiving all of my surprise billing protections form. So that's like the red flag for us. And, this might be an area where states might want to change the way the hospitals have to write this form and title it something differently. It's a model form. It's not mandated that it has this title. So that would be area where you could make this form stronger and better, because really it's asking patients to waive their protections. By signing the document, you don't get the out-of-network protections anymore. And you're agreeing to pay the out-of-network charges of that provider. The form does include a estimate from the provider for those charges that they expect you will be charged. So you have a sense of what you're agreeing to pay for, but it's not a binding contract. So the prices could be more. So this is a red flag, and we strongly encourage people to not sign the surprise billing protection form, not waive their rights, and just ask for an in-network provider to give you those same services. You can work with your insurance company or the hospital to find you an in-network provider. Next, please. So there are certain providers who are not allowed to use this surprise billing protection form and ask you to waive your rights. And so people should be aware that any of these folks who might be asking them to waive their rights, that is an illegal action, and they should report that immediately to the CMS, who is controlling and regulating this law. There's an 800 number, and there's the website there as well. And you can easily find this just by Googling No Surprises Act. But those are the providers that are not allowed to use this waiver form. Okay, next slide. So that's just a summary of folks who have insurance and what the No Surprises Act does. There is one section in the No Surprises Act that gives people some really strong protections, even though they don't have insurance. So there are situations, either you don't have insurance or maybe your insurance doesn't cover a certain type of procedure. For people who are cash payers, self-payers, you have the ability now to ask for a good faith estimate and get it in writing. And if your final bill is more than $400 than that good faith estimate, you can dispute that bill through the provider patient dispute mechanism. And it's an easy online form, again, at the same place, the No Surprises Act website for CMS. And there's a format that they fill out, or you can ask somebody to help you fill it out for people who aren't great with the computer. Someone else can fill it out on their behalf. But that dispute has to be filed within 120 days of the first bill. But it's a great way to finally get some upfront cost estimates, and then to hold those providers accountable to those cost estimates. Okay, and then this is just a slide to share with you that we worked hard to get a one-stop shop for people to be able to call and ask about their surprise billing protections, to file complaints, to report violators of the law, and just to have a resource for them. So anyone in any state can use these resources to get more information. Some states have raised their hands and said, we would like to be the enforcers of the No Surprises Act. And so in that situation, in those states, the complaints will be sent to the state regulator, whichever regulator in that state raised its hand to do this enforcement work, and the complaints will be handled by the states. So this is another opportunity for state legislators to get more involved and understand, and maybe there's some oversight that you can do, oversight hearings, to understand what kinds of complaints are coming in. Right now, there's no requirement that there's any annual report of what the complaints are in different states. So getting an annual report, analyzing what are the complaints, what types of providers are common, Those are the kinds of things that a state might want to oversee and ask for reports on. I see a question in the chat about, does it cover dental offices or dental procedures? And no, it does not. So another great area for expansion. That would be great. Okay, so that's like the front end of things. What do patients really need? But what's the back end? How does it really work? Now the patient has gotten, patient's no longer in the middle of this dispute. Now we have an out-of-network provider asking an insurance company to pay their bill. So what happens? The insurance companies receive the initial billing and they make a payment towards that bill. If the provider that sent the bill doesn't feel the amount is sufficient, then back and forth for 30 days, the provider and the insurance company can negotiate what they're going to pay for that out-of-network service. If they can't come to an agreement by the end of 30 days, they can use the arbitration system set up under the No Surprises Act. It's a little complicated, but the basic parameters are an independent arbitrator who's certified by the federal government is hired to determine the final amount that will be paid to that out-of-network provider. Each party makes their best offer. It's called baseball style arbitration. And the arbitrator has to choose one or the other of the two offers. You've probably been reading the headlines about litigation by the providers, hospitals, and physician groups to weaken the No Surprises Act. And this is a large part of the focus of their litigation, is talking about this arbitration system. So in the regulations for the law, the arbitrator is told exactly how to look at this and make their decisions. There is something known as the qualifying payment amount, or the QPA. Basically, that is the in-network rate that a provider in-network in that area has agreed to with other insurers in the area. And so we're taking it's basically like the local market rate for doctors who do hip surgery. That would be kind of the starting point for the arbitrator to look at if there was a hip surgery dispute. And so using that QPA, they would think about the best offers from both sides and see which one is closer to the QPA. Now, there are other factors that were delineated in the law, like the expertise of the physician or how complicated the case was, that an arbitrator could consider when making a decision. But those were supposed to be secondary. The QPA was supposed to be the first thing to look at, and then these other factors may come into play. That's what's at dispute in the litigation brought by the providers. And unfortunately, just this week, Texas District Court struck the provision that made the QPA kind of the center point. So now the arbitration directions are in flux while this case is ongoing. But overall, the good news is that the bill is working very well for consumers. And having this dispute resolution system is a way to try to bring down costs. We have to work hard to protect it, to protect the arbitration system as it was originally intended. We'll be doing that work. We'd love to work with you on that. But the arbitration end of things is how we try to keep our overall healthcare costs down for all insured people. So now I would just like to spend a couple of minutes on ground ambulances, which were not included in the No Surprises Act. So we'll go to the next slide, please, Jen. The ground ambulances transport about 3 million insured people every year to an emergency room. And because so many ambulances are not in insurance networks, about 1 out of 2 people are at risk of getting a surprise out-of-network bill. And in this next slide, you can see on the map that 50% chance of getting a surprise bill varies tremendously by region. You can see, for example, places like California and Texas have much higher prevalence of out-of-network charges from ambulances. What's the average cost? Well, our next slide shows that the average cost is about $450 for an ambulance, but I'm talking to patients all the time that have bills in the thousands. And you can see, again, we have a lot of variation regionally. from the low in Maryland to, some pretty expensive average bills and median bills in other states. But as I mentioned, well, maybe I haven't mentioned it yet, but again, the states led the way with protections, and we do have on the next slide, we can show you the 10 states that have protections from ambulance surprise bills. And as we talked about, these laws can't protect people who are in ERISA plans, but they are protecting people who, the rest of the 40% of their residents who get a surprise out-of-network bill from their ambulance. So we're really interested in making sure that more states join these 10 states so that we can get the attention of Congress and make sure that we get a federal solution in this area as well. So on the next slide, I'll show you the No Surprises Act did establish that ground ambulance surprise bills were a problem, but they didn't solve it. Instead, they established a ground ambulance and patient billing advisory committee. The committee will start meeting next month, and it's a chance for us to really research the problem, understand our emergency transportation billing and business models. And the committee is tasked with putting out recommendations to end ground ambulance surprise billing. Good news is that the meetings will be open to the public and streamed so everyone can join virtually. And I've provided here a link where you'll be able to find everything that the committee is doing. It's a pretty open process. So you'll be able to see what meetings are being held. You can register to attend. Notes and things like that will show up on that once we start meeting. I serve on that committee as the consumer representative. And of course, I welcome working with any of you on bringing important information from your states to the committee. We're still looking for people to serve on subcommittees that are being established as part of this bigger committee. So I urge you to reach out to Jen or myself, and I'd be happy to talk to you more about getting involved and representing the consumer voice on the committee and talking about experiences that you might have in the states on solving this problem. So that's a broad overview. I think just I'll summarize some of the things that I talked about for options for state legislators and staff to think about doing in your own state. But obviously, ground ambulances still needs to be addressed. We talked about expanding the protections to other healthcare settings. In the chat, we got the question about dental care. Other doctors' offices, addiction treatment, birthing centers, all of these would be ways that you could expand the protections of the No Surprises Act to more settings. And then you should think about what your state is doing about enforcement. Many states said they would do the enforcement of the federal law. So I think understanding better what your state is actually doing on it, doing some auditing of hospital records or physician offices to make sure that no one's sending illegal balance bills. I think it'd also be really great to try to figure out how many of those surprise billing waiver forms are being signed, who's asking people to sign them. I just see that as a potential for, some, undercutting of the protections under the law. And my final tip to you, Jen, is, just for yourself personally or anyone that you're talking to, is the last slide, which is a really important question, and words really matter. Many people say, do you take my insurance? And of course, they'll take your insurance. They'll bill what they can to the insurance. But it's a very different question when you ask, are you part of my plan's network? That is getting at the heart of it. So oftentimes they'll answer, yes, I take your insurance, but they're not actually saying, I'm in your insurance network. So final tip of the day, and really happy to open it up for questions.
All right, we've got a couple questions already in our Q&A and in the chat. So we'll start with those. And if you've got questions for Patricia, you can use the Q&A feature to ask your questions.
So I try this first one. Can you clarify when arbitration applies? Right. So if there's a problem with the patient and the patient has a balance bill, then that is not arbitration. That people should go to the 800 number and file a complaint there, and it will get handled that way. Arbitration is involved when the insurance company and the out-of-network provider are battling over what they should be paid for treatment for a claim. And so they have 30 days to negotiate it out, try to come to an agreement of how much they should get paid. If they can't come to an agreement, they can bring in this third-party independent arbitrator and go through the process of proving the bills and showing what they should be paid. And that's when the arbitrator is looking at that in-network, average in-network rate to make the decision. So the patient will not be involved in any kind of arbitration. Okay, let's see.
And then there's some other ones in the Q&A. Do you want me to read those out loud? Or
Sure, please.
So one question is if there are any areas of incontinuity between California law and the No Surprises Act.
I haven't done that deep dive recently. I think you could, it's my understanding there are some emergency transportation protections, but we definitely need a stronger and better and more inclusive law. But I'd be happy to, and Jen, I would be happy to work with you and talk and do that deeper dive and work on it. I understand there is a piece of legislation introduced or being introduced in California that might be a vehicle, first of all, I think it's focused on ambulances, but maybe there's a way to close any gaps as well.
And then there was a California specific No Surprises Act law that was passed several years ago, and the federal law just expanded that. It had limitations to who it applied to, so expanded it to more folks. But yes, there are still gaps, ground ambulances being one of them. These slides we can make available after the presentation, so we will send out an email with that information. And then if the No Surprises Act is a federal law, how can states regulate the surprise billing protections form?
So the surprise billing protection form is mandated that this option is available, but how it looks and all of that is recommended through a model form that CMS has put out. But it's a model form. So as long as you are including all of the elements of it and it's serving the same purpose, you could actually make it a little bit stronger. There's a few things that we've been recommending. First of all, changing the title. So what you would be doing is basically mandating that the hospitals in the state use the California version of the surprise billing protection form. That would be like your legal ability to do that. And then, so besides the title, other things that I think would be really important, right now it's pretty weak on recommending to patients that they ask about any kind of financial assistance that they might be eligible for. As you know, nonprofit hospitals have to offer financial assistance programs. So having specific information right there on the form, like if you're having trouble paying your hospital bills, please, use our hospital's financial assistance program, dial extension 474 or whatever it might be. So like having very specific information about that individual hospital's financial assistance would be great. Or letting people know how they can sign up for any kind of state benefits programs would be another way to make the form stronger. And really I think those are the main things, but some of the model form is a little bit dense and hard to understand. So you could run it through your health literacy analysis and make sure that it's at a, third grade, fourth grade reading level would be great.
Okay, any other questions? If folks folks are typing them in, if you have any further ones, I will also share a few things in the chat. So we have, and I will email this out as well, but here is just a fact sheet that summarizes a lot of the points that Patricia went through. And again, we will also share the slides and the recording. And then I will also share in the chat a report from the U.S. Education Fund that was released in December that goes specifically into the high cost of ambulance surprise bills and compares state action on ambulance surprise bills in particular.
Yeah, I encourage all of you to educate your constituent services staff in your offices. Make sure we have some really great resources we'll be following up with. So make sure that they know about that. So if people are calling in and asking questions about their medical bills, it's a great, resource for your constituent services staff. Or if you're doing newsletters, summarizing some of their protections and sending them to the, letting them know about the CMS webpage. All of those things would be, great ways to just spread the word. CMS hasn't done a big outreach yet, and we're just starting to collaborate with them in the different regions to do more public education. They're going to be launching a new, more patient-friendly page in the next year, I guess. I'm not exactly sure when the rollout will be, but pretty soon. I've had a chance to look at some of the early versions of it, and it looks great. So I think we'll be seeing a lot more public education, and that's another great role that each of your offices can do to help spread the word about the protections.
Okay, great. And then I just put the slide up here again with Patricia's contact information. So if you do have other questions that come up, feel free to reach out. And then we'll end it there. Thank you all so much for joining, and have a really great rest of your day.
Thanks, everyone.